Hey everybody, this is Dr. Schaefer, and today I'm going to talk to you about how to do an endometrial biopsy. Okay, so first of all, why are we doing an endometrial biopsy? This is a procedure that might be ordered for your perimenopausal or menopausal patient who's had some dysfunctional uterine bleeding. And so abnormal bleeding in that time of life is considered cervical cancer until we rule it out. And so doing an endometrial biopsy is one thing we can do in our clinic to assess and work that up a little bit more before the patient has to be referred out to another institution. So what we can do is take a sample from the lining of the uterus, which is the endometrium, and send it to the pathologist to analyze and see if that person looks like they may be at higher risk for endometrial hyperplasia or endometrial cancer. So what does this mean for the patient in terms of doing the procedure? So first of all, when the patient is scheduled for this, they should be in a procedure slot. And when they come in, they should be given a consent form for a medical procedure and asked to look this over. Now, it is the provider's responsibility to actually obtain that consent, but as a nurse, you can certainly give that to the patient and ask them to start reviewing it. Other things that are going to come in handy when you're setting up your room are, let's see, we're going to take a look here. So there's our consent form. There's a maxi pad for after they're done. You're going to want some sterile gloves, some iodine for to clean the cervix. You're going to want a specimen cup, and you're going to want to get that labeled with the patient's name and date of birth. And then you're going to need a pipette to actually collect the cervical sample. I'll go over that more in a minute. And there's a couple of other instruments and tools that might come in handy. So let me talk through the procedure a little bit and what might happen in the room as the procedure is being done. So your patient is going to be undressed from the waist down. So you're going to want to get them all set on the table, probably with a blue chucks underneath and a drape to cover the lap and legs. You are going to want to use the stirrups for to support the legs. And then the provider is going to want to place a speculum to be able to visualize the cervix really well. Now, you may or may not be aware that there are different sizes of speculums. So the provider may just be able to get what they need, but they also might ask you to provide them with a speculum. So let me really quickly just kind of point out the different sizes in case you weren't aware. So here at HCHC we have 3 different plastic non-reusable speculums in the drawers. And these all are similar in design, but they are different sizes. So we have the blue ones, which are larger and longer, and we have the white ones, which are more narrow. You can maybe see the difference there. Most of the time, however, we're going to use the green one, which is a medium. Okay, so you might want a large or a small depending on the patient's anatomy, but a medium is going to work in a lot of cases. Now, I will say that when visualization of the cervix and stability of the speculum is really key, your provider might want you to use a metal speculum, and there's a couple of reasons for that. The plastic ones are not going to be super stable, especially with women of larger BMI. They won't stay open, they can pinch. A metal speculum, this is just a medium metal one, is actually going to be stronger and more stable when it's in the open position. So for a lot of procedures, your provider may ask you for a sterile speculum, but they also might go with one of the plastic ones. So you want to have all of these available in the room. You don't need them all out and open, but you do want them within arm's reach. Okay, so for an endometrial biopsy, the patient is going to be positioned on the table. The speculum is going to be placed and the cervix is going to be visualized. what happens next after the cervix is visualized is the provider is probably going to ask for betadine, or if the patient has an iodine allergy, maybe Hibiclens, and some of the large Q-tip cotton swabs, okay? So probably 2 of these is all you need. You need to dunk them in here, hand them one at a time to the provider who is going to clean the cervix, moving from the inside to the outside, okay? And then you're going to want your trash can nearby so that those can be deposited in the trash, all right? Now the next thing that needs to happen is to get into the uterus, you have to go in through the cervix, and this is the part that for a lot of patients can feel crampy and uncomfortable. Sometimes we are lucky enough that we can pass the pipette through the cervix without any other instrumentation being needed. So as the nurse, you're going to want to maintain sterility. So at this time, after cleaning the cervix, your provider probably will change out of their clean gloves into a pair of sterile gloves, and you'll want to open those up and provide those sterilely. Next, you're going to open your pipette and make it available to your provider. The pipette looks really pretty straightforward. It is a long plastic tube, and it is going to be inserted into the uterus, and then the plunger is going to be pulled back by the provider, who is then going to rotate the plastic inside the uterus, and this tube is going to fill up, hopefully, with endometrial tissue. Once that is full, what you're going to be doing as the nurse is opening one of the specimen containers, and then the provider, you will hold the specimen container while the provider holds the pipette over it, and without touching it, hopefully, to make it sterile, we'll depress the plunger, depositing our sample in the container for the pathologist. And then the cap goes on, and this goes to the lab, labeled with all that. And then this becomes trash and is deposited in the trash, at which point the procedure is done and the provider removes the speculum and the patient sits up. Now, what can sometimes happen, unfortunately, is that this pipette will not pass easily. The cervix can be tight, it can be constricted, especially in a menopausal woman, and so your provider might ask for 1 or 2 other instruments in order to make this easier. And so I just want to explain what some of these instruments are. So first of all, if we need to hold on to the cervix and stabilize it, your provider might ask for a tenaculum forceps, okay? And in the container, it looks like this. And you're gonna open this sterilely, if you can. Okay. And it is kind of pinchy, okay? And this is placed on the cervix to hold it still, and that is important so when you're passing that little pipette that it doesn't move away from you. So the provider may put that on, clamp it in place, and then proceed with the procedure as I'd already described. This is a little ouchy for the patient, but it's usually pretty quick. But the places where it grabs when it's removed, you can have a little bleeding at those sites. So that's one of the places people can have post-procedure bleeding, okay? So your provider might ask for a tenaculum forceps. The other thing that your provider might ask for is a uterine sound or a dilator. These are both instruments that help open the cervical os a little bit and make it easier to pass. So this, the dilator looks like this. It is It has two ends, and one end is 3 millimeters and one end is 4 millimeters. And those are used to gently sort of pass through the cervical opening. And again, it's done sterilely, so you open that sterilely if your provider asks for it. And then finally, the other thing they could ask for is a sound, which is a big, long instrument. It's got a handle, looks like this. And the sound is for determining the depth of the uterus. It also can open up the cervical opening a little bit if that is needed. And again, opened sterilely, looks like this. And it's marked off in terms of centimeters. Okay, so you hopefully, if you're doing an endometrial biopsy, will be fine with just your pipette and your speculum. But you should have in the room with you also a uterine sound, a uterine dilator, and a tenaculum. And when you open these instruments, don't throw away your sterile sleeve quite yet, because if the provider uses this and then hands it back to you, they may need it again, so you can put it back in the sterile sleeve so it's not exposed to like the sink or it's thrown away. So especially with like a uterine sound, a lot of times we make a pass with the sound and then we attempt to go ahead and collect our sample. If we still can't get through, I might take that back, get the sound again, go again. And so when all that's done, the patient will be done with the procedure. They'll sit up, they may have a little bit of spotting. You're always going to want to provide your patient with the option for a pad afterwards. And if they're at all lightheaded or woozy, you're going to want to get them some water or some juice, not sit them up too quickly, and give them a chance to kind of breathe and collect themselves before they get up. So that's endometrial biopsy, and I hope that was helpful.